Welcome, ladies and gentlemen, to another episode of the Texas Examiner Kendall County Edition. I'm Robert Saenz, and my co-host here is Jon Tipton.
Hey, good day, Kendall County. We're so excited that you're joining us for another episode. I think you're going to be pleasantly surprised with the information that we're going to present for you today, especially since it's a topic that it's not talked about very often. And I'm pretty positive that most of you haven't even ever thought about these as being challenges or issues that we look at from a county perspective.
Absolutely. So from the food we eat to the establishments we visit here in the county, these two guests today are very important people that keep us all safe. And so I'd like to welcome Kera Dutton with Texas A&M AgriLife Extension. Welcome, Kera.
Thank you.
And also Miss Brenda Bell, our Kendall County Health Inspector that oversees all the establishments in this area as well.
The one and only Brenda Bell.
The one and only.
One and only. Love it.
So Kera, let's talk about a little bit about what you do. Tell us your role in the community and how you keep us all safe.
Sure. With Texas AgriLife Extension, I'm a family and community health specialist. So I'm in charge of adult programming in the county. One of the things I do, or one of the adult programs I teach, is I teach certified food managers. I teach that course to become a certified food manager. So
is that the same course that, like, if I wanted to take a course online to have a food truck, I could take it, but actually we can actually take it here with you?
That's correct. You can take it locally, and a lot of people prefer that. I think it's easier for certain type of learners to kind of take a live class and learn from someone who's actually teaching the class itself. You can take the class online, but you can also take it with us here in Kendall County, and we're up to offering it about 4 times a year.
4 times a year.
Yes.
Do you get a pretty good turnout?
We do. When I think about good turnout, I think a good class size is between 5 and 10.
Okay.
That tends to be a good size for the way we teach the class, and we tend to have at least that many people each time.
Now, do you think the number of students in your class is directly proportional to the amount of new restaurants that we're getting in town?
I think it has something to do with that. I also know, though, that they have to take this class more than one time. So their certification expires and, they come back. So the majority of people that I've had take the class are actually taking it for, they're not taking it for the first time. They're coming back taking
for
it
recertification.
Certified. That's
so
exactly.
Hooters hasn't sent anybody to you.
No, but I'm waiting. I can't wait until I get that.
I'm still thinking, Jon. Miss Bell, Brenda Bell. Brenda, I met you the hard way. I opened up a food truck and a music venue, the Roundup Music Venue, years ago, and I joked with Miss Bell that she was very fair and helped me learn a lot about food safety and because I just jumped in it. I didn't know anything about the restaurant business, and so as our health inspector, Brenda, tell us what you do and.
Well, a little bit of my background is, excuse me, I have a little cold today. I came into Kendall County, but I started with the military. I started as an environmental health specialist, and that's where I got my training from. I stayed in the military until I retired in 1998. And all my training actually came from the military.
Okay.
You're well-rounded with that type of training. You do environmental health. You do swimming pools, pest control.
Not just restaurants in it.
Daycare centers, restaurants, troop housing, government housing. So you get well-rounded. And we did STDs, sexual transmitted diseases. So you are equipped to, no matter where you go, you have the skills to do the job.
Okay. So were you working at that particular time? Were you working for DHS or were you falling under the garrison commander?
I was under the medical corps.
Okay.
Medical corps. But when I went into the military, I initially wanted to be a nurse.
Okay.
And I only had 2 years of college and I need to finish getting my bachelor.
Right.
Well, when I got in the military, I said, I want a Monday through Friday job.
Right.
And so environmental health, you have to test. And I did well. So I went to environmental health not knowing what I was getting into. But it was Monday through Friday.
Right.
So, but when I got into it, it was really eye-opening for me. I learned a lot through the military.
So when you came to Kendall County, you were ready to.
So when I came to Kendall County, I had the experience from the military training that allowed me to endure.
Well, I think it probably exceeded the expectations or the requirements for what the county.
Yes, because when I came on board, there was not a sanitarian. They didn't have anyone covering the area except for when the state would send someone out periodically. But that limited them to what they could do because they did not have the authority to enforce anything. So they just came out, took a look, and then they left.
How long ago was that you got here?
I came to Kendall County in 2000.
Okay, you've been here a while then. Okay.
Yes, and I was, at that time, it was the state,
Yes.
the county, in a city with the interlocal agreement, and I actually worked directly for the state. And then in 2005, that was a pilot program because it had never been done. So it was in Bandera and Kendall County. So I came to Kendall County. And Bandera, we stayed in that pilot program for 5 years. Bandera ended the program. Kendall County, at the time, the judge, I think it was Judge Goodman, said, we want to keep her. And so the state offered me a position to stay or leave. And because I felt compelled to, I had so much more to do. I was just starting.
Yes.
I wanted to stay.
Well,
So
thank
that's
you for,
why I
thank
wanted
you for
to stay.
doing that.
Yes,
Right.
yes. And Kera, how do you work with Miss Bell?
We do. We try to work on the certification classes together
Okay.
for sure. I'm also in a lot of kitchens.
Uh-huh.
And one of the things I've done for years as a registered dietitian is kitchen inspections. So we're used in a lot of kitchens as a preliminary inspector, where we'll come in and go through a kitchen and tell them, hey, these are the things you need to work on before the health inspector comes.
Oh, okay.
So that's something I do. I don't do it routinely before Brenda or Dave
Right.
go into places, but that's one of the roles we take on as dietitians.
Are you invited in, or do you?
Most of the time I'm paid, believe it or not.
Oh, really?
Yeah.
Wow. Okay. Good.
A
Good.
lot of facilities pay consulting dietitians
Okay.
to come out and do things like that, so they're ready for inspections, and so they're serving safely as well. So they're serving safely to the public.
That's interesting.
So she get a warm invite.
Exactly.
Right. Warm invite.
We get an invite, but it's not always warm.
Right.
So, but our job is to go out and make sure that the environmental aspect of inspections, as far as sanitation, is in compliance. And the state has minimum rules. So that's what they have to follow, the minimum rules. And we just go out to make sure that they comply with those rules for food safety for the community. And for the most part, a lot of them do that. But, you got some who, if they just doing the minimum rules, they're not going to make it too long. They're
That's
going to go
right.
below the minimum rules. And that's where we go in, we educate.
So Brenda, if I'm starting one of our listeners is starting a restaurant or a food truck for that, what do you advise someone who's just starting it out for the first time?
First, before, and I this is from experience,
Mhm.
the first thing you want to do is find out what are the rules for that county or that city so that you can comply with the rules.
So they vary by city and
It
county.
varies. The basic rules are the same, but the process of how to go about getting your inspection and meeting the requirements, you want to check with that general.
So what about
Yes,
Kendall
we-
County?
So Kendall County, when you have a mobile unit or a new facility you want to open up, first you need to contact, if it's in the city limits, you need to go through code enforcement for a structure, for a building.
Okay.
If it's just a food truck, it's directly to me.
Okay.
And then I would give them directions on how they need to go by.
So you don't have a counterpart with the city.
No,
Okay.
no.
You cover both.
David and I, my other inspector, we cover the city and county.
Okay.
That's because the city and the county have an interlocal
Interlocal.
agreement.
So you're not just there as a gotcha,
no,
you're there
no, no.
to help businesses get started on the right foot,
To
right?
be honest with you, yes. When I first started with Kendall County,
Mhm.
there was nobody here. So being from the military, you will, you shall, and you must.
That's
In a
right.
nice way. But then we have a way to get you to comply. So first, when I came on board, I had to introduce myself because people didn't know,
Right.
What is an inspector? What do they do? So when I went out, I found out that a lot of people had no clue
Yes.
about rules and standards. So my thing was to educate first
Mhm.
so that they know what was required. And then I introduced into Bernie, the, just lost my train of thought.
Certified manager's course.
Certified manager course, because the state did not require it at the time.
Mhm.
Mhm.
And for me, it was a challenge to try and teach somebody something and they don't know what the requirements are.
True.
And I didn't have time to teach everybody. So at that time, my boss was the county attorney. That's when we got together. And I said, I need this in order for me to be effective in my job. Or else I'm just going out burning my wheels.
Well, and is it expensive, Kera, the process to get these certifications?
No, I want to say, and I don't know the cost off the top of my head, but somewhere between $100 and $150 to
Yeah,
become
it
certified.
varies depending on who you take it with.
And is there like a manager's course and a food handler's course? Is that correct?
That's correct. There's two courses. There's a course that's more in depth to become a manager
Right.
because the expectations are higher because they're the ones who are enforcing all the rules and meeting the guidelines. And that is a more expensive course and it takes a bit longer because you learn more materials.
Right.
The food handler's course is for anybody who works in food, serving food. Everybody who works serving food has to have a food handler's certification.
Your son just started working somewhere else.
Yeah, he's working right next door. And is it okay? I guess we just he's working right next
Yeah,
door.
we're here at Kellum Family Medicine in Bergheim. And
right next to Bergheim Pizza Company.
give them a plug.
Yeah, why
We'll
not?
get a free pizza out of it.
Maybe we'll see. So it's interesting. You've said several times now some key words that registered with me, and that's compliance and codes and code enforcement. So, what are the actual teeth that give you the ability to do your job? Now, I know in some cities or some jurisdictions that your health inspectors are actually TCOL or TCO certified. They are actually licensed peace officers, and so there's some interaction there. But what is your status in that regard?
To be recognized as a sanitarian by the state, you have to have a bachelor's degree.
Mhm.
You have to take a state test, and then you have to pass the test, and then you are considered a sanitarian.
Okay.
And you're under certification. So for me is to go back to the question you asked was what allows us to enforce
Mhm.
the rules.
Mhm.
Is the county and the city has to adopt the Texas Food Establishment Rule, which is the state rules. That gives myself and my other inspector, David, the authority to go out and enforce the state rules. If we did not adopt the rules, I can just go out there and do an inspection, but I have no enforcement authority.
So does that require, let's say, for example, you have an establishment, you receive complaints. I'm assuming that's where you get a lot of your information from. Somebody may call and say, hey, there's something going on.
Sometimes, but we do routine
Well, you do your routine schedules inspections. What if
She does routine inspections.
what happens if you have a non-compliant restaurant or food facility owner that they want to continue operating, but they don't want to let you in to inspect, and they tell you something like, "Oh, I need a warrant for you to come onto my place." How does that work?
We have the authority governed to us by the county.
So that hasn't happened?
No, because that's what we adopt.
Mhm.
And if they refuse to let us do our job, then we have the authority to say, I need you to close.
Interesting.
I need you to close. I need you to comply. Now, if they refuse to comply, then we can get back.
So then you go into the court system at that time.
No. We,
Okay.
at that point in time, call for assistance.
Yeah.
Because we already have the authority.
Bring the chains and the locks.
That's what I'm saying. Okay. So it's a law enforcement interaction.
It's in our ordinance, and it's our county ordinance, city ordinance, that we have the authority. Now, when we go in there, we don't go in there to be a bully.
Right.
We go in there to educate. And for most time, we'll ask them to voluntarily close.
Mhm.
And if they refuse to, then that's when we will put our sign up and say you are now closed.
But Brenda, is there times that you go into an establishment, you find a deficiency, you don't close them right away, don't you? Give them like a
No,
period
no.
to correct it?
Yes,
Okay.
we have a risk assessment form that we use.
Okay.
So we follow that risk assessment form. And if a facility is having some issues with time and temperature,
Mhm.
or refrigeration, if they have another refrigerator that's working, that's keeping the food, overall, we look at the whole picture before we close a facility.
Right.
So it's not like we just go in and close them.
Gotcha.
But if there's one in particular that if you have sewer backup, it doesn't matter.
Right.
We have to close you.
Yeah, that's a danger to.
Yes, unsanitary.
And what about you, Kara? Do you also get involved in some of this, like for special events or community events, county events?
I really don't, but I always serve as support. I'm
Okay.
there as backup as support. If there's ever a question that a dietitian could assist with, or that AgriLife Extension has something support-wise we could offer, we're there.
So so I guess what I'm hearing is if I'm a new restaurant owner, I should use you as a resource. I should contact you and get your
could.
help before.
You could.
Okay.
You'd be better off starting with Brenda because she
okay.
can give you the actual rules and regs.
They don't want to start with me.
Can you tell? Can you tell?
Yes, you could always call me at some point in time and say, "Hey, before Brenda comes in, could you come by and take a look at things?" And so it would be more like a soft.
So you don't you don't have the same law enforcement authority like she would to
No,
shut it down.
No, I don't.
But you got her phone number.
Correct.
Okay.
And I have the background just to
Okay.
help them and say, hey, this is the reason that this has to work this way. This is the reason that she's going to look for this, or whoever your inspector is
Right.
going to look for this. Because everything is based in science, and it's based in trying to prevent foodborne illness. That's our whole goal. Our goal isn't to shut down restaurants.
Mhm.
It's to educate the people who work in them and who manage them and who manage the workers to understand that they could cause a significant illness to their patrons. And so we want to be the people that say, hey, let's get ahead of this. Let's
Right.
not get behind it. It only takes 2 people suffering from symptoms after eating the same things at the same place to be an outbreak of a food illness, of a foodborne illness. That's not many. That could be you and your wife, or you and your
That's
son.
happened before, by the way.
Wow.
And that's the
Yeah,
problem. A lot of people
right.
don't report it.
Correct.
So they
don't
may call.
recognize it.
They may call my department and say, "Hey,
Yeah.
we got sick. We got somebody sick," and then we will go out there to make sure they are compliant. So an inspection really helps. It doesn't hurt.
Sure.
Because when you go out to do an inspection, you have proof that the health inspector came. We do a thorough inspection. They are in compliance. The likelihood of someone getting sick here is minimum because they follow the rules on food safety. So it's always explaining to people. It's like, this will help you in a way.
Mhm.
And when I go in to do an inspection, I try and educate instead of just do the inspection. I try, why is this temperature out of temperature? How long has it been? What's the rule? Why do we need to keep it at 135? We're not spending too much time and not making them so nervous. So, because I want them to be able to feel free to come to me and say, "Hey, this is what's going on. How do we correct this?"
Right. I didn't know that.
I didn't either.
Pretty interesting. I'll tell you what. When I took the course, Kara, that you're referring to years ago, it really taught me a lot, not just for my business, but at home. They hate me at home because now when I barbecue or I fix food, I have to have my prep board and I have to have my board for.
Oh, come on now. I got to call BS on that because I saw a post on social media the other day where you were cooking meat on the back of a trailer.
Let's not discuss this right now.
It was with him. He wasn't serving to the public. So it was good.
Thank you, Brenda. And that's a good point. So you're going to throw me under the bus like that, John. As long as I'm feeding myself, right?
You can handle it any way you want.
Anyway, but if I have a business, then
if you have a business, you need to follow the protocol about washing your hands,
yes,
making sure the food is cooked
So I
at the
can't
right
tell her you
temperature.
charge me $5 for that? No.
oh my God,
Making sure your hot food stays hot,
Yes.
and your cold food stay
That's right.
cold, and proper rotation,
Yes.
first in, first out. And a lot of restaurants know those rules. It's just a matter of having someone to remind them.
right,
And that's where the food manager come in.
right,
Yeah.
And the food manager is supposed to guide those that have food handlers, because the food handler is a 1 hour course.
Mhm.
The food manager course, it can be a 2-day or 8-hour course. And that goes over a lot of things about food safety.
okay.
So when the health inspector come in, this is the way I view it. When I come in and I know my food manager is well equipped and doing the job, I could tell right away as soon as I walk in
Sure.
how long I'm going to be in doing an inspection.
Accurate.
And Brenda, so you said something earlier that's so important. I wish I'd known this. Years ago in El Paso, I went to this restaurant twice and I got super sick. Never thought of calling the health inspector. I should have. And that's what happens, I guess, with a lot of people. They get sick. They don't think of calling your office, right?
That's true.
It's important for the rest of the community to
Most of the time when people get food poisoning, and I have had it myself as a
Yes.
health inspector, you think, okay, this doesn't agree with me.
right,
Mhm.
It's not until you get all the symptoms that you realize, hey, this is food poisoning.
right.
And people are hesitant to say something because they say, well, none of my other family members got sick.
Right.
Maybe they didn't eat the same thing.
Yes, that's kind of what happened to me. It's like, well, maybe it was something else. I don't
So,
really.
yeah, so I would say if you know you got food poisoning, give us a courtesy call. We may not be able to run out every time, but
Yes.
we will definitely look into it.
And does the Kendall County have some database or somewhere where I could go and see which restaurants have failed their inspections? Results of your inspections?
Well, we don't have that right now, but I'm hoping to work on it for next year. We do have our program software called InspectGo that allows us to do our inspections on an iPad, and we can get out, get in, and do our inspection, not have to sit there and write it up. They have an extended software program that I'm looking into with the approval, if the court approve it, as to where we can put the inspection report as where's the scores. And
So that would automatically upload to a
yeah,
portion of the
and
website for you.
it allows us to not have, miss document placed on the servers because
Perfect.
it comes directly from that software,
So, and
or you
not,
turn the information wrong.
not to put you on the spot, but is that a large ticket item? Is that what's the cost of that
The
software?
program that I have right now, which is the InspectGo, where we do it on the iPad, that's $4,100 a year.
Okay.
That's all.
Yeah. So
And then for the additional
and for the additional, then it would be $10,000
per year.
per year.
So we're basically going to the commissioner's court and asking them for an additional $6,000 to support you and help you do your
And
job.
I have to do my legwork with that. I have to present them with all the facts, and I have to get all my facts.
So don't get ahead of her.
Well, I'm
And
just
then
setting the stage because I think it's important.
Comparison, like I had the last time when I first did InspectGo, I
Mhm.
had two companies that I picked. One was a little bit more costly and more wanted you to have a 3-year contract.
Right.
And I didn't want to do that. I wanted to kind of like see what it was like for the first year. So Inspector Go gave us a 1-year contract, and every year we renew the contract. And if we decide that we don't want that contract, we only have a 1-year contract.
So you didn't get to go they didn't take you on a fishing trip or, go somewhere.
Oh,
right?
no.
Okay, just making sure. We got to keep it.
No.
So, John, I mean, this doesn't sound like something that you want. I'd like to.
I'm excited about it.
I'd like to be able to go in and see, hey, which restaurants are passing.
Well, we can
passing muster.
take her information, and then we have a new segment on the show called, like they do on KSAT,
Blue
the
Plate
Plate Award.
Blue Plate
Yeah.
Special, yes.
So I don't know if you guys remember, but I think it was the Bernie Star. They used to post our inspection report. They would come into our office, and I will allow, not
Yes.
allow.
Is it
but
public information?
It's public information.
So, Brenda, before the break, we were talking about your needs and things that might assist you in programs that you're looking forward to in the future for your department. And you mentioned that you're looking at some software that could potentially, or would, if you were able to procure it, would provide the results of your inspections and make them available online for.
Yes.
Could you explain a little bit about that?
Well, the program would be with a company it's a software. It's with the company called Inspector Go. We use them right now for our inspection, as far as digital inspections, where we're able to go out with our iPad and do our inspections and email the inspection to the facility right then and there.
Okay.
So they have an extended program where it will allow us to also do our inspections online, as well as put the scores. And so I would have to go before the commissioner court and have my information, and if they approve it, and we have to look at 2 other companies or 1 other company to make sure that it's
Multiple bids.
so that if we do go with them, that I had done my
That you did your due diligence on that, right? And approximately, what is the cost?
The cost for that one in particular is $10,000 a year.
$10,000 a year.
Additional 6 to the 4 they're already paying.
Right. Well, that's a small investment to make on making this information available.
Absolutely.
To the
And I'd like to know which restaurants
Absolutely.
pass muster or not. And we just had our county commissioner on another
We did,
episode.
yeah.
We're going to have to call him back and say, hey, commissioner,
We'll get on the phone since we're done here.
get another $6,000 for Brenda. And what about you, Kara? Is your program funded?
We are funded through Texas A&M. AgriLife is a branch of Texas A&M University.
The county doesn't throw in any dollars?
The county does throw in dollars on
Okay.
salaries in our office.
Okay.
And they throw in dollars in other places too, computers, software, and a couple other areas.
Okay.
So you're a line item. You're on the budget for your particular office.
Correct. There's 2 agents. We have 3 agents total in the office, and 2 of the agents are funded through A&M and the county. The other agent and our office manager are county funded completely.
Okay. And I must say, is that Steven Zeller?
Steven
Okay.
Zeller and I are both funded through the county and the state.
Okay, got it.
Correct.
Do you feel you have, I'm putting you on the spot here, do you
Sure.
feel you have enough resources right now with the growth of Kendall County? Do y'all think you need more personnel?
I do feel like we have enough resources right now. I feel like we do a good job in our office, team working and sharing what we have to do. So I do feel like we're well supported by the
Right.
county.
And I say that too, because before it was just me.
Yes.
And I was doing it all. So now I have a partner, very consistent. He's good at his job. So more doesn't always mean you're going to get more done.
Well said.
You know.
Maybe more drama in the office.
Yes.
You have to use your time wisely,
Yeah.
because you definitely want to be able to be productive. You don't want to have more people than you need.
True.
Yeah.
Tell us a story, Brenda. Tell us, what is
Good
one?
story.
The good story when I came to your place. No.
Oh, there we go. There's a statute of limitations.
Okay.
Tell us the story of a funny case, and then also maybe a serious case. One of the
I'll
cases
start
that
with
you
the
had to
serious one
Yes.
first. And I really don't recall the name of the business, but it's where the old Broken Stone Pizza used to be.
close. Okay.
And I don't know the name of the business, but the gentleman started out with a facility restaurant, and as time went on, he wasn't making the money.
Mhm.
You probably heard about this if you lived here. He set the place on fire.
Oh, that's right.
And how does so you had to get involved in it?
So the fire marshal took the lead on everything.
Right.
Mark Maddock was at the time, and they had their own investigative. What they wanted us, for me at the time, was just me, go back and look at his health inspection report. That's why reports are so important.
Interesting.
So when did he start going down in his
They wanted the trend analysis.
and this
Yep.
particular time, I went in and I had to close him because he had no hot water.
Mhm.
The food was not in the temperature that it should be. We had some expired items
Mhm.
and general sanitation. So at that particular time, I answered to the county attorney. Whenever I had to close a facility,
Mhm.
I don't just do it on my own.
Right.
I let my supervisor know, was the county attorney at the time, Don Ali.
Right.
And I would call him and I would tell him briefly what was going on. And he would support me and say, do what you need to do.
Fantastic. Well, that's pretty serious.
Yes. And then I have some good ones where you go into a facility. When I first started, they weren't doing so well. They didn't have hand washing sinks.
Mhm.
You explain it to them, and they start following the rules. They try and get things up to standard, the basic standard. And it was funny, one of the people said, "Oh, the plumber, he loves you." And I'm like, I don't even know the plumber.
Right.
Because all these places didn't have the basic hand washing sink. They were going to the 3-compartment sink to wash their hands. So you can't do that. You have to have a separate hand washing sink.
Just give me a flashback when I was a DFAC officer. I'm like, whoa, I didn't know I had to be responsible.
So, but people don't, at that time, we don't have it like we have it currently where they have the education and the training.
Mhm.
At that time, they didn't know.
Right.
And so somebody had to come in and tell them and train them.
Right.
So when I first started, it was the basic thing of getting you to comply with the basic rules on food sanitation. So to not take too long, my reward is when I hear the citizen, which, they see you because they know you. They go, "Oh, you're the health inspector. Oh, thank you so much." And then they'll tell you also what places are not
Yes, I
even
bet.
a clean
Right.
facility.
I bet. And I've got to say, we joke a lot, Brenda, you and I, but you were a breath of fresh air. You were very fair. You didn't cut any slack, but you were very fair, and also always educated me and the staff, so that we could improve. And it seemed like you wanted us to succeed. You want the businesses to succeed, and so it wasn't a gotcha all the time.
No, and really, when you're in business, if you take care of your community,
Mhm.
your community will take care of you.
Absolutely. So that's why I think that software is so important. Also,
I agree,
hold people
100%.
accountable. And Kera, you probably have a lot of statistics to share with us, don't you?
I
about
do
our
have
community?
some. Well, not necessarily about our community, just in general about food safety.
Okay,
I brought
sure.
some of my basic food safety facts.
Love to hear that.
And these are what I teach in the management course, the food
Okay.
service managers course that I teach. So 1 in 6 individuals will become sick with a foodborne illness in each year. So
1 in
that's
6.
really a lot.
It's one
That
member of
is-
every family almost. Yeah.
Pretty much. You're exactly right. And so
Wow.
a lot of times what we shrug off as the flu or it's going around,
But-
like Brenda was saying, or
Yeah.
you were talking about, it's actually not. It actually might be a foodborne illness.
Okay.
It doesn't necessarily have to, be just your family. Maybe someone else experienced that same sickness at that same restaurant that night and you're just not aware of it.
That's true.
Mhm.
So that is the importance of the courtesy call if you think something's going on in a restaurant.
Okay.
More than half of foodborne illnesses that occur in restaurants are attributed to improper food handling. So it's a time and temperature specific thing. Normally, our food has to be at certain temperatures, either hot enough or cold enough for certain times.
Mhm.
And that is the backbone of food safety and preventing foodborne
Right.
illness. So I think it's actually more common than most people think about. And that's one of the things students learn in the class. My students come in with a lot of experience. Typically, like I said, they're usually not a first-time test taker. But a lot of times, just brushing up on these facts about foodborne illness, I think it just makes them more aware and more cognizant of what they do on a daily basis is important. It's not just rules and regulations. And I think that's one of the reasons they see Brenda as, they see her as a team player.
Gotcha.
I don't think they ever see her as someone who doesn't play on their team. She and David refer people to my class. So, they'll notice when their certificate or certification is about to expire and they'll say, "Hey, we have a class coming up in the county if you want to take that." And so that's been a nice way to work in the community with the community.
Right.
Yeah.
Right. No, I was just thinking, Robert, going back to this software and being able to publish the results, maybe a way to encourage citizens to be more forthcoming with their information is maybe we could implement some sort of a reporting procedure on the website where, somebody can come and say, "Hey, I went to this restaurant and I experienced these systems." That way they can do it at 11 o'clock at night when you're not in the office and it's on their mind and they want to make that report. I don't know, just a suggestion. Would something like that work, or would that be...
We have a plan, and I have a plan, and it's just a matter of presenting to the court. And so our budget time is usually
Mhm,
annual.
mhm.
But the plan would be also to have, if there's a complaint, a complaint, and then they can put their request in that way.
Yeah.
Because we're not always in the office.
Right.
Majority of the time,
Well,
I
you're
am.
out doing your job.
Yeah, I'm in the office because I do the administrative as well.
Mhm.
Do new building constructions as far as food establishment. So we cannot spend a lot of our time on the phone, but
Right.
we try our best to get back to a person within a reasonable time. And usually it's me. It's end of the day if I don't get back to you within the same hour or so.
And that's actually very impressive. If you're that kind of response time, you can't find that in some pay, or commercial private commercial industry. You can't get that kind of
Customer service is
There you go.
important.
Huge.
It's
Yes.
important.
And who's your boss, Brenda? And,
I answer to the county judge in the commissioner court,
okay.
and I also answer to the county attorney.
Oh, okay. And about you, Kara? Who's your
I answer to the county judge and the commissioner's court. We are, they are our bosses, even though we're funded through the Texas A&M system. And we have a boss in that area as well, but they're our ultimate. They have to be happy with what we do ultimately.
Sure, sure. Well, wonderful. I guess in closing, I'd like to ask you, your jobs sound very interesting. And Brenda, so some young lady or young man out there is considering a career in your field. What would you suggest to them? How, what advice do you have for them?
If they are in high school, I would probably tell them, look into public health. If they want to go to college, look
Okay.
into public health, and then find out what's the requirements to be a sanitarian with the state, whatever state you may be with, because every state may be different. But with Texas, you go to the Texas website, and they would tell you the requirements for that. And if they can, try and get some internship kind of thing to see if this is what you really want to do.
Can I get an internship in your
exactly what I was thinking.
We don't do internship
Okay.
because we don't have the capability nor the room. I did have one person that wanted to do an intern, and I referred her to San Antonio because
Okay.
they have an internship program already set up.
Great.
But what I would like to see, if young people are interested in it, you kind of want to find out early on before you get into it. You don't want to spend all your time getting a degree and then get into the field. You're like, this is not what I want to do.
Right.
But public health and sanitation is a broad aspect. You can go into many fields. You go into food safety. You can go into water or swimming pool, bacteriological. You go into pest control.
Right.
And there are other aspects you can go into. But pretty much you got a variety of things in environmental health.
Sounds good.
Yeah.
And in your field, Kara, it's nutrition.
Right. I'm a registered dietitian licensed by the state of Texas as well. And it's been a great career.
So you recommend that?
I would recommend it highly.
Fantastic.
It's heavy in sciences, heavy in chemistry, but
Leverage
also,
you out, John.
I know.
also
Two boys that are smart enough to do that stuff.
there's a lot of food safety and food science involved. And so I would say the same thing. It gives you a broad view. Nutrition gives you a broad view, a degree in nutrition or becoming a dietitian. You get chemistry, you get science, you get food safety. If you're a kid in high school, one of the things I would say is work in a kitchen. Make sure you're not scared by the big equipment, the big stove, the big
Good
oven.
advice. Good advice.
Make sure that you're comfortable around food, because if you become a dietitian, you can work clinically in a hospital and do other things, but everything comes back to food eventually. So you have to have a comfort level.
Well said. Well, John, any parting words?
No, I think we've covered it all. Ladies, thank you so much for your time.
Thank you. It's fun.
I'm excited about this episode. The listeners and viewers, I hope you're as excited as we are after having just watched this. So we'd encourage you to please, if you haven't already, to hit the bell button for notifications if you're watching on YouTube. Like, follow, comment, and share if you're on one of the social media platforms like Facebook or TikTok where we have a presence. And please just stay active with our page so you can be kept up to date with all the upcoming episodes and latest information that we can provide to you or to the community.
So thank you for tuning in, folks, to the Texas Examiner. I'm Robert Saenz.
And I'm Jon Tipton. Thank you so much for your time today. Have a good one.